Medicine is a very complicated system. And if you're going to navigate your way through medicine, you're going to need somebody that you can say, oh, let me ask a question about. Let me see what somebody else had to do for this.
Nobody knew what to do with me. I had a really weird bleeding internally and was in a wheelchair and had been put in the hospital, and they sent me to conventions, and I would have 500 doctors come in and see me in a day, and nobody really knew what to do.
Right. Didn't know what it was.
No, they didn't really know what it was. I later found out after I went through school what I actually had.
Hi, I'm Dr. Jim.
And I'm Dr. Janine.
And we're Doctors Nutrition. We wanted to kind of introduce ourselves, tell you a little bit about us, why you might want to listen to us over the time.
Right. And we've been doing clips on YouTube. We've been doing a TV show locally for 10 years. We've done media for years. And we did a podcast years ago, but we hadn't continued it. So we are going to tell you a little bit about our approach to natural medicine, because we do think that we have a little bit of a unique approach.
Oh, it's definitely unique. We've been told that 1,000 times at least. And the thing about what we do, we started out 28 years ago, and we wanted to have a truly scientific way of looking at nutrition. 28 years ago, or 30 years ago, honestly, a lot of nutrition was, well, if you've got this symptom, do this, and take this. Well, maybe that's what they needed, maybe that wasn't. So it really wasn't a lot of good science behind what people were given, what doctors were giving people for various nutritional deficiencies, blah, blah, blah. Didn't know. Honestly, they just didn't know. So over the time, though, research has come out, and it's here.
Tons of research. And we've been for over 20 years, been doing it to where we do the lab work, and then we look at lab work to decide what people may need. And we have seen a lot of things over the years. We have seen almost every condition. And there might be a lot of people that do podcasts that have one area that they're big on, just one little area. I can say we really don't have one area. We have a lot of areas because we have done this for so long, and we have done overall health. And that's what we do.
Yeah.
I can honestly say that's what we've done for the people, public around us. And that's what we're going to continue to do, is we look at lab work, and then we can tell what people need more nutritionally. And everybody's a little different. You can have the same exact symptom and need a different thing than the next person. So that's why we like to kind of individualize what we tell people. Now, we will give generalized information because, of course, speaking to all y'all out there, y'all might not, know every little detail about your lab work. So we're going to kind of tell you what to look for, what to look at, what you can do naturally to help it, because that's what we do as natural medicine.
Right. And like I say, we've done it for so long. I don't think there's a condition that you could probably come up with that we haven't seen.
It's rare that we hear of a new one.
Yeah,
we do occasionally. I'm like, oh, I hadn't heard that one.
Yeah.
And then usually when it's something that we haven't heard of, it's a very rare condition.
Very rare.
Yes. And we have had people over the years come in with absolutely everything.
Yeah. I don't know. I've lost count on how many people we have had, in our office, in the middle of having a heart attack.
Yes.
And you have to convince them to go to the emergency room.
Yeah, we have them coming in. I'm having chest pain, so I came here. And I'm like, oh, no, don't come here. Go to the emergency room. So that's another thing. We're going to tell you when is the appropriate time to use natural medicine.
Right.
And when is not. Because when it's an immediate life-threatening condition, you do want to go to the emergency room. That's what, to me, modern medicine is best at, is more emergency medicine. It's the chronic everyday conditions that we see lacking tremendously in treatment.
It's like she said, a lot of the chronic medicine is where modern medicine has let us down as patients. And she and I both had our own health concerns, so we've been both sides of it. We've been the doctor and we've been the patient. Okay, so we understand both sides of this equation. And the thing about it is, we've seen chronic conditions over the years. Medicine has just got to where they basically just throw things at it. You got this symptom, here, take this. Watch your TV tonight when you're watching TV. I'm sure there'll be at least a dozen ads in your favorite shows that you'll see about some medication for God knows what.
Right.
They're out there.
But you also get to hear all the side effects that those medications have as
Right.
well. So that's why we like people to be proactive. We like people to do prevention. We always stress prevention first because you don't want to wait until there's a problem. Now, if you already have a problem, it's not too late. There's no doubt.
Nope.
Not saying if it's, you already got it, then too late. But it's always better for prevention. And we are actually seeing younger and younger people wanting prevention. We are getting that now. And that's the good thing is that people are starting to be more proactive about their health. They are starting to look at, they don't want the side effects of the medication. They want to do something different. And that's what we've done for years and years is we've done something different for a long time before it was even the thing to do.
Yes.
So we have been at this for a long time, and we think we can give you good insight on overall health and how to keep yourself healthy and how to be your own advocate. Because nowadays, I'm sure if you've been to a doctor or tried to go to a doctor, or you need to be your own advocate. Somebody's got to be looking out for you.
Time and time again, I've heard people say, well, I haven't had any problem with healthcare system. It's okay. And I have to ask, have you ever had a problem? And most of them will turn around and say, well, no. I go in for my yearly checkups, things like that. Okay, good deal. Now, so you haven't had anything seriously wrong with you yet. Yeah. Because when you do, you're going to find out just how equivalent that advocate comes in. Because if you don't have a good advocate on your side, or if you're not your own best advocate, you're in trouble.
Or know how to be your advocate.
Right.
That's the big thing. A lot of people don't know how. I just yesterday talked to someone that they found out they had breast cancer. Yeah. Okay, so they're going to have surgery to do a mastectomy. No, you think, okay, no problem. Insurance should have no problem with okaying that. They told her she'd had the date set, and they said, oh, well, that's not within the 2-week period that we could review this. And she's like, what do you mean? And they said, well, it's got to be 15 days out, so you got to change your appointment for 15 days later when it's cancer. Now, she herself is much her biggest advocate, and she started looking and found out that in the state that she was in, there was a law that they cannot use that 15-day rule when it's cancer. So you have to know that. And as soon as she brought that up to the company, they okayed the procedure, and she's able to have her surgery this week. So you got to know what you're looking at. You have to know the ins and outs of the way medicine works. We ourselves don't take insurance, but we will mention insurance at times and how maybe to deal with things that come up with your insurance.
Right.
We might talk about how to do natural medicine. Definitely that's what we do the most. So that is what we do. We might talk about when there are tests that you have and what they show, what you might ask the doctor, what you might ask them to check. Again, it's being your own advocate. So giving you more information.
Yeah, I think, we're going to give you 28 years worth so far of life experiences. Patients that we see, we won't be giving their names or anything, but we're going to be telling you their stories.
Yeah.
What they went through and how they overcame the problems that cropped up in the medical system in America today. Because, when you think about it, America, we spend more money than, than any other country, and probably more money than any 2 or 3 other countries spend on healthcare. And yet we rank number 30-something, I think, in overall
longevity.
Health. Longevity.
Yeah, so it's not making us live longer to spend more money in medicine. I think it would be better to be smarter and to actually take care of yourself and don't just wait for someone else to do it for you. And that's what we hear all the time is, oh, well, if insurance companies don't cover it, I'm not going to do it. Well, you know what? Sometimes you have to take care of your own health. And that's where nutrition comes in, because there's no insurance companies out there that actually pay for you to be healthy nutritionally. We even see people, I have seen in the past many, many times, where somebody's doctor prescribes a prescription nutrient and insurance won't pay for it. So it's not going to pay for it, even if it's prescribed by your doctor. So it's one that you want to look at what you need yourself, because it's worth it in the long run for you to take care of your health. Your health is your biggest asset.
Yeah, it's sort of like your car insurance. You have car insurance, and if you happen to have an accident, maybe they'll pay for it. They may not, if it happens to be your fault and blah, blah, blah. There's rules and regulations that they may be able to get around it. And same thing with your health. It's your health. It's not the insurance company's health. It's yours. So it's really important to you. Not important to them at all. It's important to you. And what we have found over the past 28 years is that we help people take care of their health, regardless of who's paying for it. Doesn't matter. What is the best thing for your health? That's what you're going to see in our podcast.
And there's many times, like even with seeing our own patients, that, it might not be something that just a nutrient's going to fix. So we tell them what type of doctor to seek out. Right. We tell them where to go. People don't know. People don't know where to go next. And
we've got so specialized in medicine and subspecialties. You've got specialists, then you have subspecialists. So, when you look at it from that standpoint, the medicine is a very complicated system. And if you're going to navigate your way through medicine, you're going to need somebody that you can say, let me ask a question about. Let me see what somebody else had to do for this. And like I say, for 28 years, we've done that. We've helped people navigate the system. We've helped them get their health back in a lot of cases, most cases, get their health back. And so we're just going to be bringing you those stories. And we think that's the best way. Like I say, we're not going to be advocating, one particular thing. We're going to tell you what it is to do natural medicine, using natural medicines and natural formulas and stuff for your health, and how you would apply that. And we'll be talking a lot about diet. A lot of our podcasting stuff will be about diet and things that you can do, diet and lifestyle. So we'll be bringing you a lot of that too. So
And occasionally you might see our little dogs jump up with us.
Yes.
As you just did, might have a minute ago. Our studio is at our house.
Yes.
And they do come and go. So they actually might jump up here with us, and we let them because, we don't want to stress them out and get them out of their surroundings. Because one thing about being healthier is to keep down stress, right?
Exactly. And they're our stress relief.
They are. Well, dogs are known to be good for stress. People don't realize that. Is that actually animals are very good for that.
Yeah, all animals.
Yeah, all animals. Now, people are always asking us, over the years, is what got us into doing what we do. Right. So, we actually have been together for over 30 years.
Well over
30 years. And when I had problems back when I was very, very young. Actually, probably from the time I was born. But one of the big problems I had was more once I hit 17 and ended up in the hospital for about 4 months. And at that time, I had talked about, I always knew I was going into medicine somewhere. I did. I knew I was always going to probably be in the healthcare field. But after what I went through when I was 17, I kind of learned I needed to go a different route because I experienced what medicine can do when they don't know what to do. Yes. I guess that's one way of putting it. Yeah. Nobody knew what to do with me. I had a really weird bleeding internally and was in a wheelchair and had been put in the hospital, and they sent me to conventions, and I would have 500 doctors come in and see me in a day, and nobody really knew what to do.
Right. Didn't know what it was.
No, they didn't really know what it was. I later found out after I went through school what I actually had, and it was something called an immunoglobulin deficiency, which means I'm missing parts of my immune system, and I do have problems, with the immune system. But with having that, I have actually kept myself really good over all these years without doing the medical procedures. Now, when I was young, they didn't know what it was. And not long after we started doing this, 20-something years ago, we had a patient come in that had an immunoglobulin deficiency. And like anything that walks in our door that I'm not familiar with I'll go read about it. Yeah. I don't like not knowing. So I go start reading. And it was me. I was like, man, I have had everything that this thing lists. And I said, I wonder if that's what I always had. And they just didn't know what it was. So I did the testing, and sure enough, it was an immunoglobulin deficiency, which can easily be tested. So with that, over the years, I do take a lot of supplements for it because one of the problems with an immunoglobulin deficiency is infections. People tend to have infection after infection after infection. And so that's one thing that I have not had to deal with over all the years because I take enough. One thing I take is the Olivir. Couldn't live without it. Antibacterial, antiviral, antifungal, antiparasite. And it is something that we have used on many different things that people didn't know what to do with. And it definitely can make a difference. So I myself have dealt with chronic problems. And I would have been labeled, I'm sure, if it would have never been, it gotten as bad as it did, I would have been labeled fibromyalgia because it gives you the chronic fatigue and pain all over and things like that, that so many people out there have. And a lot of the people I talk to, they're always like, oh my gosh, you understand what I'm talking about. I mean, because you could look normal, but you can have some things going on that makes you not feel very well. And that's what I find is definitely lacking in today's medical system. If you look okay, they're like, okay, you're okay.
You're fine.
And you don't want to go through life feeling bad all the time. So there's things that you can do, a lot of things you can do. And doing testing is one of the ways that you can find out. Everybody has to, everybody's a little different on what testing might show up, even with the same problem.
Yeah. Something too that we do a little differently than a lot of the people that are quote unquote doing functional medicine. And we were doing what we call it functional medicine now, but when we did it 29 years ago, whatever it was, Dr. Land had just come up and Brand had just come up, I think, and coined that phrase, functional medicine. But now the people, you talk to somebody about functional medicine and they talk about these, what I call esoteric kind of testing, that might cost thousands and thousands of dollars. We start with the basics. What does the basic lab work show? Does it show a vitamin D deficiency? Well, if it does, let's fix that and see what happens.
Yeah, we start low because we know that not everybody can afford thousands out there.
Right.
And if you can, great. We can do all that testing as well.
Yes.
I mean, we do all the functional medicine testing, but we always start with the basics because you can do all these nutrient testing. And you can see, okay, my amino acids are in range or not in range. It still don't tell you if you have a thyroid problem.
Right.
So we got to look at the basics first. And we can start as low as $160 for basic testing. And it goes up from there because the more even basic testing that you do, the more that it costs. And like I said earlier, we don't deal with insurance because insurance doesn't allow just testing to see what's there. No. You have to have a reason for every single test ordered. So we find a lot of problems that no one else has found on people because they didn't do enough testing.
Right.
And if you do enough testing, a lot of times it'll show up what the problem is. And so that's kind of how we're different than even other functional medicine testing. Because believe me, we get many people that come to us with a stack of stuff they've already had done at their functional medicine doctor.
Right.
And we go through it and it costs them $5,000 to $10,000 to do it. And they don't have any of the basics there. I'm like, you got to have the basics. I mean, so we do the basics, find out what's going on. And we also try to do something for what we find, which you'd think that was kind of like a duh, but we do. Unfortunately, we have a lot of people that come to us that's had the testing shows right there what the problem is. And there's nothing that's been done about it.
Right.
So I guess we kind of look at things more logically, maybe. I don't know. But we kind of do logical. And we fit it to the person's budget as well, because the person, not everybody can afford the same thing every month. And if it's $2,000 a month and you don't have $2,000 a month, then it's not going to help you. So we kind of help people no matter what their range is and tell you the most important things that there are to look at. And like he mentioned, vitamin D, that is a very inexpensive test. It's a very inexpensive to take, and it can definitely help a lot of problems. So that's the kind of stuff that we will tell you. Now, another area that we have done a lot, like I said, we're not specialized in one area, but one area we've done a lot in, and I feel like we're very good in, is cardiovascular because of his risk. He actually has a horrible family history.
Yeah.
There is no man that's lived past, no immediate family member, grandpa, or dad, brothers, things like that have lived past 61.
Yeah.
And he's 76. So he has lived way longer than the rest of his family.
Yeah, it's, it runs in my family. And a lot of people out there do have cardiovascular issues in their family. Mm-hmm. We've had to learn, because of me, we've had to learn how to apply the science that's been out over the past 20-some years. The science has really, really made some big inroads. And so we've learned how to take that science, apply it to me and others, and we've been able to correct a lot of the problems and keep things going.
Yeah, because cardiovascular risk, and he did in his 40s have all the same things the rest of his family had. He was insulin resistant, which many people out there are.
We'll be going into depth on insulin resistant. You might find out you might be a little.
He had fatty liver due to insulin resistance.
Right.
I mean, he had uncontrolled high blood pressure.
Yeah.
And this was in his 40s, so this is 30 years ago.
Yeah.
And now he is not insulin resistant. His blood pressure is normal without medication, and his fatty liver is better. So you can reverse these things. And a lot of people they've been told it can't be reversed. And that's not true. And we have seen on many people that come in and on him that you can reverse cardiovascular disease. You have to do things different. You have to change your lifestyle. You have to change your diet. It is not just one thing that does it for every person. And so you do have to be proactive, and you do have to do the right things in order to get there. And you also have to have the right testing to know in which area you have to work on. Because even with plaque, some people might increase plaque due to their high homocysteine. Mm-hmm. Some people might increase plaque due to their high oxidized LDL. Other people, it might be the lipoprotein A. Mm-hmm. Other people, it could be their high triglycerides, their insulin resistance. Mm-hmm. There's so many different factors on cardiovascular disease. There's not one thing. And if you don't know which of those things that you have, how do you know which of those things to work on?
You don't. That's the whole problem.
Exactly.
And, like I say, we're going to be bringing, like I say, we'll have a lot of things that people that we've...
we'll give you case histories.
We'll give you case histories. We'll cases. This person had this, and this is what we did to start with. This is what we found out they had a problem with. And this is how we help them correct that problem. That's the key. Look, there's some great guys out there and gals too.
There are.
Let me tell you what. There's some great guys and gals out there. They do, and they specialize in various areas, and they do some phenomenal work. Mm-hmm. Phenomenal. I mean, you can get some great information from these people. What we're going to do is, if you got all this information and you say, well, gee, okay, how do I apply it to me? And because I don't really fit the exact same mold that this other person did or whatever, then that's what we're going to be able to help you do. So it's a little different. And it's, like I say, not being a quote unquote, authority or specialist in every area kind of helps us look at the overview and make it work for you.
And to me, our area is nutrition, just natural health, ways of doing natural things to help you be healthier. Live healthy, be healthy is the way we've always said.
That's one of our mottos.
One of our mottos is live healthy and be healthy.
Yeah.
But you have to it does take a little work. I tell people every day that, the people that you see that are healthy and not overweight and doesn't have all these problems, it's always not necessarily that they just were lucky. Now, there's those ones out there that are, but that's a few. Most of the people that we see that are healthy and thin and active and, as they're getting older, they work on it.
Oh, yeah.
They do things to get there. And so that's the kind of things we're going to talk about is what you can do to make yourself healthier, stay active as you're aging. And even if you're young, start early. If you know your problems when you're young, then you can, especially the genetic issues you might have, doing something about it when you're young that's the time to do it.
It truly is. Yes, I mean, we get an awful lot of people who don't do that. They wait until they've had the heart attack, they've had whatever.
Well, that's pretty human nature.
That's human nature, right? I always tell them,
wait until you fall apart.
Sooner or later, it'll happen. And so that's and then they come to us and say, okay, what am I going to do? I don't want to have that again. Well, no kidding. That's not much fun. So they're going to look and start doing some things. Now, that's one way to approach it. Yeah, it would be great if you do that at a younger age. And we understand that being human, people tend to wait until they've had some sort of major event because sometimes something has to get our attention, whatever that happens to be.
Yep.
And if it happens to be a major health crisis, okay, hate to say it, but we'll have a major health crisis and then we'll decide, hey, it's time for me to get healthy. And another thing that we're going to help you do, we keep up with research because
We do.
we spend an enormous amount of time reading through the literature and the research to apply to our health, even if it's something small that you can take back into your daily life, use it, and become better for it and healthier for it.
I think that's about it today.
Yeah.
And we've kind of laid out what kind of things we're gonna talk about, and we're gonna pretty much talk about all kind of different health issues. So it's not just one area; it's gonna be a range of areas, whether it be cardiovascular risk, immune system, osteoporosis, prostate health, breast health. I mean, name it. We're gonna probably talk about it because that's what we do day to day. We do deal with multiple different issues every day.
Yes, we do. And so that's kind of laid out, like she said, that's laying out exactly kind of how we're going to approach this thing for you. It's basically just taking a day in the life of us and seeing what we see every day. And when we think there's a nugget there that might help somebody else out there on the other side of this camera get healthy, then we're going to bring it to you.
Yeah.
And hopefully you get something out of it. The big thing we want you to do is right now, just go ahead and subscribe to the channel. Doesn't cost you anything. Ring the little bell over there. It'll tell you that when we got a new podcast up and so on. So if you just kind of follow us along, like I say, it doesn't cost anything. See how we do. If you like us, tell somebody else about it because maybe it's a family member, maybe it's a friend that might need a little help or encouragement. Thank you for joining us here today. Hopefully you'll be joining us a lot in the future.
Yeah.
And so for now, we want you to live healthy and be healthy, and we'll sign off for today very soon. I'm Dr. Fox, and I want to thank you for watching this YouTube video. Be sure and hit that subscribe button, hit that little bell so you'll be notified on any upcoming videos that we have coming up. And thank you again for watching our YouTube videos.